Hi, welcome to Chapter 13, Psychological Therapies. These are the objectives we'll be covering. I won't read these to you, but they are in your PowerPoint. Plus, if you open up the regular PowerPoint, you'll be able to open up the My Psych Lab survey. It says, how do you take care of your mental health? First of all, let's talk about treatment in the past. Historically, we did not have a very good history with dealing with people with mental illness. In Bible times, it seemed like they referred to them as being possessed by a demon or something like that. Mentally ill people began to be confined to institutions called asylums in the mid-1500s. Treatments were often harsh and often damaging. Felipe Pinel became famous for demanding that the mentally ill be treated with kindness, personally unlocking the chains of inmates in France. There's a real famous what's called the David Rosenham experiment in 1973. The Rosenham experiment was a famous experiment done in order to determine the validity of psychiatric diagnosis, conducted by psychologist David Rosenham. He was a Stanford University professor. He published the Journal of Science in 1973 under the title On Being Sane in Insane Places. Rosenham's study was done in two parts. The first part involved the use of healthy associates, or pseudo-patients, 3 women and 5 men, including Rosenham himself, who briefly feigned auditory hallucinations in an attempt to gain admission to 12 different psychiatric hospitals in 5 different states in various locations in the United States. All were admitted and diagnosed with psychiatric disorders. After admission, the plan was that the pseudo-patients act normal and tell staff that they feel fine and no longer experience any additional hallucinations. All were forced to admit to having mental illness and agree to take antipsychotic drugs as a condition of their release. The average time that the patient spent in the hospital was 19 days. All but one were diagnosed with schizophrenia in remission before their release. So the second part of this study involved an offended hospital administration challenging Rosenham to send pseudo-patients to its facility, whom its staff would then detect. Rosenham agreed, and in the following weeks, out of 193 new patients, the staff identified 41 as potential pseudo-patients, with 19 of these receiving suspicion from at least one psychiatrist and one other staff member. In fact, Rosenham had sent no pseudo-patients to the hospital. The study concluded it is clear that we cannot distinguish the sane from the insane in psychiatric hospitals, and also illustrated the danger of dehumanization and labeling in psychiatric institutions. Let's take a look at therapy. It involves treatment methods aimed at making people feel better and function more effectively. There's 2 broad categories. One is primarily in the psychological theory and techniques, and the other uses medical intervention to bring symptoms under control. There's a nice little video here on how to seek therapy. One of the things they recommend is if you're a student to go through your school. Every school has a counseling department where you can get help. Psychotherapy is a therapy for mental disorders in which a person with a problem talks with a psychological professional. There's what's called insight therapies, and these are psychotherapies in which the main goal is helping people gain insight with respect to their behavior, thoughts, and feelings. Action therapy is psychotherapy in which the main goal is to change disordered and inappropriate behavior directly. Biomedical therapy is a therapy for mental disorders in which a person with a problem is treated with biological or medical methods to relieve symptoms. Psychoanalysis it's insight therapy based on the theory of Freud. It emphasizes revealing of unconscious conflicts. Often he would do what's called dream interpretation. In interpreting the dreams, he would discover what's called the manifest content. That's the actual content of the dream, but he would help interpret the latent content, which is the symbolic or the hidden meaning of dreams. So he thought a lot of the dreams would shed light on what's called the subconscious processes. Freud also used what's called free association. There's a technique in which patients were encouraged to talk about anything that comes to mind without fear of negative evaluations. Then he also used a term called resistance, which occurs when a patient becomes reluctant to talk about a certain topic, either changing the subject or becoming silent. He used the term transference to refer to the tendency for a patient or client to project positive or negative feelings for important people from the past onto the therapist. One of the issues in counseling is being directive or actively giving interpretations of a client's statements in therapy, even suggesting certain behaviors or actions. Psychoanalysis today is generally directive. Then psychodynamic therapy is a newer and more general term for therapies based on psychoanalysis, which the emphasis is on transference, shorter treatment times, and more direct therapeutic approach. Interpersonal therapy, or IPT, is a form of therapy for depression. It incorporates multiple approaches and focuses on interpersonal problems. Carl Rogers came up with what's called person-centered therapy. This is a non-directive insight therapy in which a client does all the talking and the therapist listens. The cool thing about Carl Rogers, he believed that the patient had within themselves the answer. And the goal was to build a relationship with the patient and help bring out the answer out of the patient. So he used what's called non-directive therapeutic style, in which a therapist remains relatively neutral and does not interpret or take direct actions with regard to the client, instead remaining a calm, non-judgmental listener while the client talks. To get an idea what this looks like, you can click this YouTube video or just Google Carl Rogers and Gloria, and it'll show a sample therapy session with Carl Rogers himself. 4 elements that are very important and used in person-centered therapy is authenticity. In other words, be genuine, open, honest to the client. Unconditional positive regard is you give your warmth, respect, and accepting atmosphere. In other words, if you create an atmosphere where the patient feels comfortable, they will feel comfortable sharing what's going on. Empathy is the ability of the therapist to understand the feelings of the client. In other words, it's not sympathy where you're feeling for the client, it's feeling with the client. And there's a big difference. Reflection is where the therapist restates what the client says, reflects feelings, reflects content, rather than interpreting those statements. Next is motivational interviewing, or MI. In contrast to client-centered therapy, MI has a specific goals: to reduce ambivalence about change and increase intrinsic motivation to create change. Gestalt therapy is a form of direct insight therapy in which a therapist helps clients accept all parts of their feelings and subjective experiences. They'll use leading questions and planned experiences such as role-playing. If you click this link, the YouTube video, you'll see Fritz Perls, one of the psychotherapists known for Gestalt therapy, give a therapeutic visit with Gloria. Some things they might use is role-playing, talking to the empty chair, giving them experiences to help work through situations. So it's very paying attention to body movements, paying attention to consistency with what they say and what they're doing with their body, like if they're moving their leg or something like that. And the therapist kind of points out any inconsistencies or incongruencies. Humanistic therapies are not based in experimental research, but they work best with intelligent, highly verbal persons. Now, behavior therapies are action therapies based on principles of classical and operant conditioning and aimed at changing disordered behavior without concern for the original causes of such behavior. Here's a nice little video on behavior therapy. Behavior modification, or applied behavior analysis, involves the use of learning techniques to modify or change undesirable behavior and increase desirable behavior. Systematic desensitization is a behavioral technique used to treat phobias. The client is asked to make a list of ordered fears and taught to relax while concentrating on those fears. The use of counter conditioning is replacing an old conditioned response with a new one by changing the unconditioned stimulus. Here shows a hierarchy of fear. So if a person is afraid of rabbits, they would start down here by watching a movie Hop, and then looking at a picture of rabbits, and then petting a rabbit, thinking about petting a rabbit, and then being in a room. So what they slowly do is they associate that rabbit with positive feelings using classical conditioning, so that the fear is slowly taken away. This same thing works with kids who have school aversion, who are afraid to come to school, and they first get them to the parking lot, and then they get them to a hallway or to an office, and they slowly work their way into the classroom. So aversion therapy is a form of behavioral therapy in which an undesirable behavior is paired with an aversive stimulus to reduce the frequency of the behavior. Exposure therapy is a behavior technique that introduces a client under carefully controlled conditions to situations related to their anxieties or fears. Flooding is a technique for treating phobias and other distress orders, which a person is rapidly and extensively exposed to the fear-provoking situation or object and prevented from making the usual avoidance or escape response. So you just make them face their fears and have them deal with it. Exposure therapy involves eye movement desensitization reprocessing, or EMDR. It's controversial therapy for post-traumatic stress disorder and similar anxiety problems in which the client is directed to move the eyes rapidly back and forth while thinking of a disturbing memory. The jury's still out if this is, then is effective or not. Modeling is learning through observation and imitation of others. Participant modeling is where a technique is in which a model demonstrates a desired behavior in a step-by-step gradual process while the client is encouraged to imitate the model. Reinforcement involves strengthening of a response by following it with a pleasurable consequence, or the removal of the unpleasant stimulus. Token economy is where you use objects such as tokens to reinforce behavior, which the tokens can be accumulated and exchanged for desired items or privileges. For instance, if you go over to Boys Town, they use what's called the Boys Town method. They have what's called a token economy. Every student has a little point card. On the point card, they have a list of behaviors, and they have a list of positive and negatives. And whenever they follow directions, they earn positive points, which they can later on use for privileges for the rest of the day. Privileges could be like snack, pop, use of the phone, free time, computer time, being able to go to the field house, stuff like that. When they have too many negative points on their token economy, their freedom or privileges are restricted. And it's a pretty effective way of changing behavior. Contingency contract. It's a formal written agreement between the therapist and the client, or teacher and student, in which the goals for behavior change, reinforcement, and penalties are clearly stated. Extinction is a removal of reinforcer to reduce the frequency of behavior. For instance, timeout is very effective with kids under 12. Once you get over 12, no, don't use timeout. Okay, but timeout is a process in which a person is removed from the situation that provides reinforcement for undesirable behavior, usually by being placed in a quiet room, quiet corner, away from possible attention or any reinforcement. Usually how long of timeout? I usually say 1 minute per age of the person. So if you're dealing with a 2-year-old, no more than 2 minutes timeout. Believe me, that'd be too painful for parents that do more too. So no more than 1 minute per year of age. So a 12-year-old, yeah, no more than 15 minutes timeout. Next, behavior therapies can be effective in treating specific problems such as bedwetting, drug addictions, and phobias. Behavior therapies can also improve some of the more troubling behavior symptoms associated with severe disorders. Cognitive therapy is therapy which focuses on helping clients recognize distortions in their thinking and replace distorted, unrealistic beliefs with more realistic, helpful thoughts. An example of this is they would help clients to face cognitive distortions. One example is arbitrary inference. In other words, when a client draws a conclusion without any evidence. So they say, oh my God, I am so stupid. And then you say, okay, show me the evidence. And then that's arbitrary inference. Okay, so they try to refute those negative comments. Say, can you replace that negative comment with, you know, gosh darn it, you're pretty smart, you're pretty capable. Stop putting yourself down like that. Okay, so every time you say to yourself, I'm so stupid, you replace it with, no, I'm not, I'm pretty smart. Okay, selective thinking. This is focusing only on one aspect of a situation while ignoring all the other relevant aspects. So this might be where a person just really focuses in on the one thing they did wrong without looking at the things they did right. Or overgeneralization, drawing sweeping conclusions based on one incident or event, applying those conclusions to events that are unrelated to the original. Next is magnification and minimalization, blowing a negative event out of proportion. That's magnification, or while ignoring a relevant positive event or minimizing the positive events. What was that song from Disney? Accentuate the positive, eliminate the negative. Okay. Personalization, taking responsibility or blame for events that are unconnected to the person. So those are cognitive distortions. Cognitive behavior therapy, or CBT, involves an action therapy in which the goal is to help clients overcome problems by learning to think more rationally and more logically. This is used a lot with kids who are cutting. They learn to focus on a combination of their thoughts. So they look at what are their triggers and then have a thought process and a behavior plan in action to do something positive instead of something negative. So replace the negative behavior with something positive. But it also involves focusing on thoughts and also on behaviors. 3 goals of cognitive behavior therapy is to relieve the symptoms and solve the problems, to help develop strategies for solving future problems, and help change irrational, distorted thinking. One of the people I've got to know personally is Albert Ellis, who coined the term rational emotive therapy, which he changed later to rational emotive behavior therapy, which is a combination of, you know, disputing the rational ideas and then also coming up with a behavior plan that's effective. They're directly challenging their irrational beliefs and help to restructure their thinking into a more rational belief system. If you click this video on the PowerPoint, you'll be able to watch this video of Albert Ellis and Gloria displaying rational emotive therapy. Now, CBT has seemed successful in treating depression, stress disorders, and anxiety. CBT has been criticized for focusing on symptoms, not the causes of disordered behavior. So they focus on, let's take care of the symptoms, but they don't go too much deeper into why is this person doing this. Where Carl Rogers' person-centered therapy would take more time into looking deeper, where CBT just kind of focuses on the direct behavior. So, types of therapy, goal and methods. So we talked about psychodynamic therapy, humanistic therapy, person-centered therapy, gestalt therapy, behavior therapy, cognitive therapy, CBT, and REBT. They all have different focuses, where the first two focus on insight and help them, you know, work through the negative thinking. This works really well for educated people who have a lot of insight, who are very verbal and they're able to talk about their problems. This one works really well for people who have some irrational thinking that's not working so well, and need to replace some old behaviors with some new behaviors. Family counseling or family therapy. Family members meet together with a counselor or therapist to resolve problems that affect the entire family. Um, Self-help groups or support groups are groups composed of people who have similar problems who meet together without a therapist or a counselor for the purpose of discussion, problem solving, social and emotional support. Some examples of self-help groups would be like Alcoholics Anonymous. There's no therapist, there's no leader. Together they discuss, problem solve, and turn to each other for experience, hope, and strength. Al-Anon is an excellent self-help group for the rest of the family who've suffered because of someone in their family had a problem with alcohol or drugs, because it does affect the whole family. There's grief groups that are like this. There's all kinds of different groups that you can attend. Now, group therapy is where you have a therapist in charge of the group. And this works well if you can't afford individual therapy. Also, it's good to obtain a great deal of social and emotional support from other group members. You can learn from each other in group therapy, and you kind of work your way through as you walk through it with other people. Advantages is the low cost. You can expose other people with similar problems and interact with them. There's social and emotional support from other people. What I notice in group therapy is a lot of the peers, there's a lot of peer-to-peer support, which is very helpful. Of course, disadvantages, you're sharing your time with others. There's a lack of privacy. You're putting your life out there in front of other people. So there's that level of trust you have to build within a group. There's the inability of people with severe disorders to tolerate being in a group, or some anxiety people say, no way, I'll never do that. Psychotherapy is more effective than no treatment at all. Some people wonder, oh, how effective is this therapy? Between 75 and 90% of people who receive therapy feel it's helped them. The longer a person stays in therapy, the greater the improvement. Psychotherapy works as well as alone as with drugs. I have a lot of kids who have depression. Sometimes they go to their doctor and the doctor gives them some drugs that makes them feel better. They don't have therapy. Sometimes it works, sometimes it doesn't. Some go to a therapist and they don't need to have a regimen of drugs to help them feel better. I see psychotherapy as being effective and helping helping a lot of people. Especially, it's better than not doing psychotherapy at all. Some types of psychotherapy are more effective for certain types of problems, and no one psychotherapeutic method is effective for all problems. So therapy should be matched to a particular client and particular problem. Some clients love just a humanistic type approach, client-centered therapy. Some want a more directive type therapist. Give me the answer, show me the way, and get this done. Overall, a lot of therapists use what's called the eclectic approach, which means they combine elements of several different therapy techniques. I tend to be mostly client-centered therapy. However, as a school counselor, I have to be directive because I don't have that much time with each kid to really pull it out of them. So a lot of times they'll say, okay, this is what you need to do. I give them a list. I cheat a little bit as a school counselor, just because teachers don't like it when I keep their kids out of class for more than 10, 15 minutes. But eclectic approaches, we use a combination of whatever works for that student. So cybertherapy is therapy offered through the internet. Advantage is definitely lower cost because you could meet with people online and get therapy. I don't know how they would charge for that. That'd be kind of interesting. Maybe PayPal or something like that. What about accountability? I'm not sure how that all works, but I guess this is something new, cyber therapy. There's availability of a lot of therapy, access to support groups, relative anonymity. Disadvantages, they don't get the full body language, facial, vocal tones, stuff like that. Common factors approach, there's what's called the therapeutic alliance. It's a relationship between the therapist and client that develops a warm, caring, accepting relationship. It's characterized by empathy, mutual respect, and understanding. That's important in order to have a setting of trust where a person feels comfortable in sharing and coming back. That it's a protected setting where they feel safe to share. That there's opportunity for catharsis. In other words, to connect and feel with each other. Learning and practice new behaviors and positive experiences for the client. Now, evidence-based treatment, or EBT, refers to techniques or interventions that have produced desired outcomes or therapeutic change in controlled studies. And there's a nice little video here on finding the right therapist. When the cultures, ethnic groups, or genders of the therapist and the client differ, misunderstandings and misinterpretations can occur. It's always important to consider the cultural characteristics. 4 barriers to therapy exist when the cultural backgrounds of clients and therapists differ. This would be culture-bound values, that your values are different than the culture of the person you're working with. Or class-bound values, maybe because the person in therapy might be of a different social economic class. There's language barriers, and then there's the nonverbal communication. That could all be barriers to effective psychotherapy. Biomedical therapies that directly affect the biological functioning of the body and the brain. We're going to talk about this next, is what are some drug treatments that are out there to treat psychological disorders. One is psychopharmacology. It's got the word pharmacy in there. The use of drugs to control or relieve symptoms of psychological disorders. There's what's called antipsychotic drugs. These are used to treat psychotic symptoms such as delusions, hallucinations, other bizarre behaviors. A doctor or psychiatrist might prescribe anti-anxiety drugs used to treat and calm anxiety reactions. They're typically minor tranquilizers. And then mood stabilizing drugs are used to treat bipolar disorder, such as lithium and certain anti-convulsant drugs. And then there's antidepressant drugs used to treat depression and anxiety. And here's a nice little chart that shows classification, antipsychotic typical drugs, and what are they used to treat for, side effects, and examples. Okay. Next is ECT, or electroconvulsive therapy. This is also known as electroshock therapy. It's a biomedical treatment in which electrodes are placed on either sides of a person's head. Electric current strong enough to cause a seizure or convulsion is passed through the electrodes. This is still used to treat severe depression. Somehow that electrical shock gets those synapses firing and helps treat that severe depression. Psychosurgery. This is surgery performed on the brain tissue to relieve or control severe psychological disorders. You've probably heard of the prefrontal lobotomy. And this is where the connections of the prefrontal lobes of the brain to the rear portions are severed. 6% of these lobotomies ended in death. Not quite a surgery that's done anymore today. It was pretty severe and severe type surgery. Now what's done instead of the lobotomy is a bilateral anterior cingulotomy, which is an electrode wire is inserted in certain parts of the brain, and it's for the purpose of destroying that area of the brain tissue with electric current. So the electrode is inserted with the guidance of a magnetic MRI machine, and they're able to kill off certain parts of the brain tissue that can work similar to a lobotomy, but without all the other serious damage. There's some new emerging techniques, which is called repetitive transcranial magnetic stimulation, as magnetic pulses are applied to the cortex. And then there's transcranial direct current stimulation. This uses scalp electrodes to pass very low amplitude direct currents to the brain. Virtuality is also a new technology, software-generated, three-dimensional stimulated environment, which can be used in the treatment of PTSD, also with phobias and exposing people to their fears in a safe environment. And that's the end of the show. Have a great week.